Hello, my name is Dr. Hannah Raasch, and I'm here at the American Heart Association meeting 2015 in Orlando, Florida, representing Intermountain Medical Center. I'm here with Dr. Narotsky of Columbia University, who just presented some very interesting research regarding the incidence of amyloidosis in patients who have undergone TAVR. Dr. Narotsky, can you tell us a little bit about your study?
Sure. So amyloidosis is a disease can affect the heart when the proteins misfold. It's something that not a lot of people were paying attention to before because the way to diagnose it involved invasive tests that were painful, very logistically difficult. And we were looking for a senile amyloidosis that affects older patients who in general don't want to have these kind of procedures. Our research is actually taking an old form of imaging using bone imaging, and we're applying it to the heart. And the way we do that is that we look for the prevalence of amyloidosis in older patients. The patient population that we're looking at Columbia University specifically are patients with aortic valve issues. So they have narrow aortic valves and they are being replaced using the TAVR technique.
And how many patients did you find had amyloidosis when they went through these PYP scans to look for it in the TAVR patients?
So right now we're nearly at 100 patients, and we found that about 16 or 17 of them had cardiac amyloidosis. Now, if you do this about percentages, overall it was about 15%, but in men we found that it was over 20% of the men that we tested had this disease.
That's quite interesting. So what are your next steps in order to get out awareness that amyloidosis may be more prevalent than what we thought? And you may see this in your patients that you refer for TAVR.
So now that we're finding that the disease is easier to diagnose, we're working with the drug companies to develop new medications for it, and we're working to help screen people in the regular community for this.
That's fantastic. Thank you so much for joining us here at Intermountain Medical Center at American Heart Association 2015.
Of course, thank you.